Well, good morning, all of you. Thank you for coming. We're here just to talk about this quite remarkable day 9 days ago. The fact that we did 12 transplants in one day. It actually is the most that's ever been done in one day in Texas. And it ties the record with one such event in California, when and where they cannot tell us, quote unquote. But this is a great day. It's a great celebration of life. And here on each side of me, we have patients who represent both recipients of living donor transplants, as well as organs from deceased donors here to my left. My name is Goran Klintmam. I'm Chief and Chairman of the Baylor Simmons Transplant Institute. And the Institute performs a large number of transplants. We transplant all organs currently transplanted. We do liver and kidneys and pancreas and hearts and lungs and islets, to mention a few, and then of course bone marrow, which is not an organ transplant. Anyway, we're here to provide opportunity to you to meet with these patients and hear the story from them. Dr. Mason here to my right is the chief for lung transplantation here at Baylor. And Dr. Gonzalez, who is chief for heart transplantation, is on his way here. So he will be here very shortly. So in the meantime, I want to say a couple of words. To mobilize the resources, to have the resources to be able to actually execute transplants, 12 transplants in 24 hours, is actually quite remarkable. Each and every transplant requires an enormous amount of work from an enormous amount of people. It's not just the planning before. This happens very suddenly, very quickly. And you have to have the people who can travel out and get the donor organs and travel back. We have to have the organ bank that can organize all this, Southwest Organ Bank, and Paddy Nice from Southwest is here. You have to have the coordinators to call in the recipients. You have to have the nurses on the floors, the nurses in the ORs, the nurses in the ICUs. You have to have the operating rooms available to do as many transplants. You have to have anesthesia for all these operating rooms. You have to have virtually everything. You have to have the blood available. You have to have medications available. You have to be able to just juggle all these events at the same time. It's an enormous apparatus. Some people have asked me how many people are involved. Honestly, I have no idea. It's been a large number of people. And something I want to say about Baylor, we did our first transplant here at Christmas of 1984, a liver transplant. And since that day, we have never, ever gone off the grid, if you like, because we didn't have the resources, or people were sick, or people who had worked too much. Always been someone here to work. When we have run out of, when bad weather, for example, has hit, the call goes around and people come in from home, even during the holidays. That has happened many times. So it's something we do, and this is something we are passionate about. About the living donors, and I will start with them because the first transplant ever done successfully, it was done at Peterborough Brigham in 1954. That was a living donor that actually made the whole thing realized to be possible, that we could transplant an organ and cure someone definitively with a new organ, an organ that was failing, a kidney in this case. What has happened over the number of years is that we have become victims of our own success. So we started with living donors, we went to deceased donors, not exclusively, but the vast majority. And now, because of victim of our own success, everybody now wants to have a transplant, if their organs are failing. They see this as actually something they want to do. And we are more and more dependent on living donors to actually provide this gift of life. And it's an enormous thing to see. I mean, we have two kidney recipients here, both receiving kidneys from their spouses, and they had never been on dialysis. They come here, the kidneys were really failing, got a transplant, and within a couple of days, they essentially were healthy again. And you will hear from them later on. Then we have the deceased donor situations, totally different. It's a tragedy, a catastrophe. A loved one dies. And I can say from, of course, 35, almost 40 years of experience with this, but also from personal experience, when something like that happens, the fact that actually you can donate the organs from your loved one is the only glimmer of hope in that entire time period. It's the only thing that seems to have some meaning for the families. And donation of loved ones' organs when they pass away is really a phenomenal event, a phenomenal act that people make, the active decisions they make to make this possible. I've spoken enough now, and you can cut away as much as you want of that. Dr. Mason, David, do you want to say something?
Sure, I'll just say a couple of words. I want to reiterate Dr. Klintmom's appreciation to the families of the donor organs who really have given the gift of life, and we should all thank them and remember them, and certainly none of this would be possible without them. Also, I'd like to express appreciation to the patients without whom we could not do these transplants, who have put their confidence in Baylor to come to us and put their lives in our hands. And it is truly a privilege and an honor to take care of these patients, and I think that each one of us has tremendous pride in what we have accomplished as an organization. You know, we don't look at this as 12 transplants. We look at it as 12 individual patients that we're taking care of, every one who has their own story and has their own needs and who we individually take care of. I can't imagine how many people are involved. I would have to think it's hundreds of people who are taking care of these patients, have taken care of these patients, who will continue to take care of these patients throughout the course of their lives. It's not just their transplant and then they're gone, but these are people who will become part of the family of Baylor and transplantation here at Baylor, who we look forward to long lives shared in families and children that come and grandchildren seen without this experience it would not be possible. So again, it's a great privilege, a great honor to be part of this. I see Dr. Rosenblatt, head of the lung transplant program from the medical side. Maybe you can come up and say a couple words as well.
Yeah. And as Dr. Rosenblatt is making his way up here, I just want to say, of the 12 patients, you see 4 of them here, the 3, all patients have been discharged except 1. There's only 1 patient who just were discharged out of the ICU to the regular floor, and that's the recipient of the double lung transplant. All the other patients, the 3 liver kidneys, the kidney recipient of a deceased donor kidney, and these 2 living donor kidney recipients have all been discharged. So that's quite remarkable. Out of 12 patients, 11 have been discharged, and only 1 is still in-house. Randy? This is Randy Rosenblatt. He's the medical director of the lung transplant program.
Well, thank you. It was very exciting for me to see how many people who were able to be, their life improved and actually their life prolonged by these transplants. Medical director of the lung transplant program, it was especially important as we saw these 2 people who were struggling to do their activities of daily living, even showering, walking and to be able to get a new lease on life. And to see the support of the hospital to be able to accomplish this many transplants on one day and the resources that were available and the excitement by the employees here see us as a real team.
Okay, well, why don't we open this up for the patients? And we can start on this side here.
Yeah.
Yeah, if you want to say a few words,
Well,
present yourself.
I've been treated like a rock star. It's very emotional to have a gift of life again. I'm getting stronger every day, and I just hope to prove that this was all worthwhile and give back.
And you need to tell them that
I
you
received a heart.
Yeah,
Yes.
yeah, a new heart 9 days ago, and it's here with us today. And Mr. Mitchell.
Okay. My name's Michael Mitchell. I came up for had one lung transplanted on my right side. Up until that time, I couldn't have walked near as far as I did from that chair to here without oxygen. And there's a couple of things I'd like to say is Dr. Mason and his crew and his staff are just phenomenal. You want to talk about the best of the best, well, they're sitting right there. Now, I'm nothing against the other doctors, but he was my doctor and he did his thing, and that's the way I love him for it. He had a God-given talent. He recognized it. He knew what to do with it, and he's the best. And I've had one job all my life. I've been a police officer. I was a state trooper for 46 years total, but a couple of different places. So I've seen both sides of the need for transplants, and it's just it's a wonderful, wonderful scenario for people who need what I got, which is a new start on life at 67, starting next week. So I guess I don't know how to be any more thankful than to thank God, thank Dr. Mason and his team, thank Baylor Hospital. I mean, it's been a phenomenal experience. You couldn't be treated any better at any facility. I have never been treated any better at any facility. So with that said, that's all I'd like to say is just thank the Lord for them all.
Thank you, Mr. Frank.
So my name is Daryl Franklin, 32 years old. Got a kidney transplant from my beautiful wife, and this Baylor program is really special. When you meet the people here, everyone is very welcoming. They take care of you. Before, when I needed the transplant, life was just totally different. The quality of life just wasn't there. You can't eat what you want. Didn't have the energy. I have two small kids, a 14-month-old boy and 6-year-old girl, and I just didn't simply have the energy to even spend time with them. Bad struggle. Skin was different. I mean, everything in your life is just totally different. Getting a new kidney has just been amazing. We talk about how food tastes different, how it's almost like the world is brighter to me now. This Baylor program is it's an amazing program. The surgeons are top notch. They took care of me. They took care of my wife. Just an amazing program, and I'm really happy that I chose this hospital.
And you came here from Emory, right? From
Yeah,
Atlanta.
well, yeah, so, yeah, true. So I do live in Atlanta, and I had the option of choosing Emory. But it's, Baylor is just the choice I made. I couldn't have chose any better, so.
Okay. You get the star.
I know.
My name's Joe Quinn, and I too had a kidney transplant from my living donor wife. And yeah, it is amazing. Like Daryl said, you change immediately, and they put a lot of restriction on us now as far as what we can do and what we can lift. But you just feel so much better. It's it's just phenomenal. And we have 3 kids ourselves, and they designed my shirt. And but the Baylor has just been spectacular, and I'd like to say the 14th floor nurses, man, they were all great, and the techs, and I'd like to give a shout out to Wesley, my ICU nurse, and Alicia, a tech. They just, I mean, they spoil you rotten, and it's pretty amazing. And I just want to say one thing. I'm going to plug our son. Our oldest boy is trying to raise money for the National Kidney Foundation, since obviously I was a kidney. And if you go to Vimeo.com, and you can click on a link there, and he's trying to raise money for the National Kidney Foundation, and he's making a backwards half-court shot from in basketball, but he's going to make it with football and volleyballs and all kinds of stuff. And his goal was $1,000, and he got $1,300 the first night, so he made it $10,000, and he's going to do it for 30 days. And he's pretty inventive, and so you can get on the Facebook of the National Kidney Association also, and he's on there too. So, but I can't tell you, the doctors and the nurses, it's an amazing place, and I'm glad I was here.
Y'all have any questions?
Yeah, let's open up.
Dr. Clinton,
Yeah.
could you review again of the 12 transplants, which were kidney, how many kidney, how many heart?
Sure.
Go through that for us.
Yeah, there were 2 lung recipients, one of a single lung and one of a double lung. There was 1 heart recipient. There were 3 patients receiving a liver and a kidney. There were 1 patient receiving a kidney from a deceased donor, and there were 2 recipients from a living donor. And I'd like to add that this is the 48th time we do 3 livers in one day. So we've done it 48 times. This is not new to us. So please, any questions?
Thank you.
All right. Thank you so much. I appreciate you coming. Thank you.